developed called Provider Equation. It's specifically for the healthcare industry. So this is, he'll go through sort of the social signaling and how Google reviews happen and all of that, and talk to you a little bit about what their product does. I'm going to turn it over to him, and then if you do have questions, I think Tiffany said there's a microphone somewhere. I mean, he may be able to hear us. He's pretty good, but we'll kind of play that by ear. Pun intended. Okay, so Lane, are you ready to go?
I'm here. How you doing?
We're good. It's all yours.
Are you guys able to see my screen and see me, or just see my screen, or just see me?
Both.
All right, very good. Well, I want to say hi to everyone. I'm on the Eastern time zone of the United States, and I hear you guys are all in Hawaii. So, it's evening time for me and afternoon for you guys, but appreciate your time and attention today. I'm sure Lisa's been keeping everyone entertained all week. I hear it's been a great class, and she just asked me to come on tonight to share a little bit about Provider Equation, which is a solution that we've designed in partnership with a company called C-Suite Solutions, which has been designed exclusively for healthcare providers. All of us have marketing executive or marketing experience in the healthcare space, and there's definitely been what we recognize as a unique need in the healthcare space for marketing and location data, reputation management, and overall web presence. So we put our minds and our technology solutions together and came up with a solution for healthcare called Provider Equation. What I'm going to do is just kind of lay the groundwork a little bit here before I get into demonstrating the technology component of our solution, and just kind of talk about some things that are relevant to not only healthcare providers across the United States, North America, and really around the world, but also really all business owners and all companies. First of all, most healthcare systems and multi-location companies want to create operational efficiencies in areas like branding, rebranding, and cleanup. Management and reporting across multiple locations is a real need. Reputation management has become front and center in the last 5 to 10 years as the likes of Amazon and Google have really put the review or the reputation front and center for all types of businesses, products, and services. So reputation management for a healthcare provider is critically important. And we'll talk a little bit more about that as we see how reputation management plays its role directly in search. Consistency of location data is a real area or pain point in healthcare, especially as healthcare providers move from one location to another, as a healthcare system may expand, or a primary care provider may expand into new locations. Managing that location data, making sure it's accurate and consistent across the entire ecosystem is a real need. And then maximizing the opportunities in search for all access points. And really, here's why. If you look at the industries most reliant on search for driving traffic, health and medical is #1 across all industries in terms of it being most reliant on Google in terms of its percentage of traffic from direct search. And so, and really, if you think about it logically, it makes sense. People are making a decision about their healthcare. They're making a decision for their children, for themselves, for a loved one. And so because we all have these things called cell phones, and healthcare is a kind of a need-based service. When we have a need, we pick up our phones over half the time now and do a search. The other, 30 to 40% of the time, we rely on a tablet or a computer, and we do our search and we look for a provider. And so it makes sense because of the importance of the decision, and because of the amount of choices that are out there, that people are reliant on search to do their bidding for when they're making a healthcare decision. Other results from analyzing over 3 billion web pages is that Google drives 8 times more traffic than all social media networks combined. So it's really important for a healthcare provider or a chiropractor or an auto repair shop to make sure that they're orienting their strategy towards at least doing well in Google search, because the statistics show that that's really the most important area to focus on. Search is the single largest traffic source for every niche, and in most industries, it drives the majority of all web traffic. And in fact, Google owns or drives 93% of all search, 69%, nearly 70% in Google search directly. Google Images really does drive a fair amount of traffic, a little over 20%. And YouTube, another Google asset or Google owned property, nearly 3%. Combined, almost 93%. So again, just looking at the pure data and the statistics, it makes sense for healthcare providers in all industries to really make sure that their marketing strategy is oriented towards doing well in Google search. So when we look at the underlying components of a web presence, whether it be a healthcare provider or any business for that matter, it's important to understand the components of a company's web presence in today's digital frontier. This has changed significantly in the last 5 years, and quite a bit even over the last decade. But in the last 5 years, Google's algorithm has gotten significantly more advanced with artificial intelligence and just pure computing power, along with just the ongoing incremental advances that they make in the behavioral components of Google's algorithm. And remember, if I just go back one slide, we're talking about Google search because it drives so much of the decision making in the consumer spaces in all industries. And so if we look at what's underlying Google and what Google's looking for in terms of an entity or a company's web presence, there are about 8 different macro categories that Googlebot or the algorithm is looking for in terms of signals. And so what I often will teach is whether it's a single healthcare provider, it's a practice manager who's managing multiple practices, or a healthcare executive who's looking at an entire healthcare system in all of their locations that are consumer facing. It's really important to understand that Google is a robot, Googlebot, and it is looking for signals, right? And so as it crawls the web continuously, billions of web pages, and it's just constantly, it never stops. It's looking for signals around each entity or around each company, or in many instances in a healthcare setting, the locations of that healthcare system are each individual entities or individualized locations. And so Googlebot is looking for these signals, and as much as we can, when it comes to marketing and strategy, we want to train Googlebot with purposeful signals around each entity or location. And these signal categories are really weighted in terms of importance. Now, this is not an exact science, but it is a science nonetheless. And when it comes to marketing, digital marketing in the 21st century, we have to recognize that there are multiple components of a web presence of every given entity or location in a healthcare setting. And each of those entities or locations needs to be paying attention to these different categories if it wants to do well in search, because these are the categories, and these 8 categories will break into many hundreds or thousands of different micro signals that Googlebot is trained to look for, identify, quantify, and then also score in terms of weighting or authority towards that entity. I'm not going to get into all the nitty gritty of this, but at a high level, these 8 categories are Google My Business signals related directly to the Google My Business listing for that location or company. Link signals, which are really votes. Links are really your link to a link to your website on somebody else's website, or a link on my site to your site. Those links are signals, and Google looks at that because it finds connectivity in the networks of websites around the web, and it looks for who's connected to who, or what websites are connected to what other websites. And each of these websites that Google is looking at in terms of links also have their own authority. And the more authority one website has over another, that also plays into the role of quantifying a link signal and whether that link signal is authoritative or less. Review signals. Googlebot is looking for reviews. Why? Because reviews are also very important to human beings. I'm sure most, if not all of you in the room tonight or today use reviews in just your normal course of life and business, whether you're looking for reviews for a healthcare provider or a restaurant or a hotel you're looking at visiting or an attraction, whatever it may be. Reviews have proven to be very important to human beings, and so Google and Googlebot is also scoring review signals. So it's important to have good reviews on an ongoing basis because they're very much a signal of authority in a local marketplace. On-page signals simply means the signals that are on web pages. Citation signals are signals around your business name, address, and phone number. In the marketing industry or digital marketing industry, we call that NAP for short, but it stands for name, address, phone number. And so Google's constantly scanning the ecosystem looking for business names, addresses, and phone numbers. And then the more consistent a business or a location's name, address, phone number is within the entire ecosystem where that might the NAP might occur, the better. Behavioral signals are things like click-through rate, likes in social, shares in social, check-ins on Facebook or in Google. All those things that show that there's interaction and engagement are called behavioral signals. Social signals, as you can see, is number 8, and it's really the last one. And although it's not extremely important, Google My Business now has its own social components as well. And so really number 8 and number 1 can have some interaction as well. So when we look at these different areas of a company's web presence, it's important to see how that actually plays itself out into the real world in search. So I'm on a search, and this is a very frequent type of search, urgent care near me, or in this case, I'm forcing the search to be near the island of Hawaii. How do you say this name here? Kailua? Perfect. Kailua, all right. So it sounds like the alcohol for me, but anyway, so urgent care near Kailua, Hawaii. Well, urgent care near me, as you can see, Google Suggest even gives me other suggestions that might be relevant to me as a searcher. And when I do this type of search, you can see a very common search result. We have an advertising or an ad up on top, and sometimes you'll get as many as 4 on top. And then we get what we call map pack or local pack results. These are the most common type of results, and these are especially relevant for mobile related searches. These map pack results are the biggest drivers of traffic, phone calls, directions, as you can see here. And in fact, Google over the last 2 to 3 years has been slightly tweaking their search results, and what we've seen in the industry is actually a decrease in website traffic and an increase in people taking action directly on these map pack results. And what I mean by that is we literally on website traffic across many industries and across thousands and thousands of websites, we're seeing actual website traffic from visitors going down. However, their Google My Business listing interactions, traffic, engagement is actually increasing because Google actually wants to keep people directly in search and not bounce them off to other pages like they do when we click on these types of results. And so, and this is especially true when it comes to the mobile searcher on a smartphone. So these map pack results are the biggest driver of traffic, the biggest driver of phone calls, and ultimately the biggest driver of consumer buying decisions. And so appearing in these 3 results, as you can see, we only get 3. There are typically other results, and we can go to the map and see more than 3 results, but Google only returns 3. Many years ago, they used to return 7 results here in the map pack, but about, I can't remember exactly, but about 3 to 4 years ago, they changed this back to only 3 results. And so making sure that your provider locations or location, if it's a singular location, show up in these 3-pack for your related type of service line and keyword searches is really important. As you can see here, I can search cardiologist, Kailua, Hawaii, or best primary care doctors in Kailua, Hawaii, or best primary care doctors near me. These are all related and very relevant types of searches. And as you can see in all of these types of searches, we see a singular ad in most of these cases, and then the map pack or local pack results. And then below that are a series of web pages, and then a couple ads at the bottom. And this is a very common type of search result. And what drives these results is directly influenced by the types of signals that Google is finding and scoring around the entities that are in each of these are an entity or a company, or oftentimes are a location of a larger healthcare system. But whether they're a location of a larger healthcare system or an individualized practice or part of a multi-location practice, they're all seen as individual entities and locations as business in Google's eyes. And these search results, as you can see here, return the Google My Business listing. And so these are actual Google My Business listings that we're seeing here, right? So if I click on this, we're going to see the details of this particular Google My Business listing. And if we go back to this pie chart, you'll see how Google My Business signals are the #1 driver of whether or not you show up in the 3-pack. So doing a good job inside your actual Google My Business listing and producing many signals out of that Google My Business listing accounts for nearly a quarter of whether or not you show up in one of these 3 results. Okay. And this Google My Business listing has information associated with it. And this is related to the business name, the business address, and the business phone number, recalling the NAP, which is part of also citation signals, the business name, address, phone number. Is that business name, address, phone number consistent? Or do we see a lot of variance out there around this particular practice? Do we have different addresses out there? And as Lisa has probably shared with you, oftentimes that's the case. And that's also sometimes what also results in negative reviews, is because there's a wrong address here in Google. Someone picks it up on their phone and then tries to actually go to that location. And when they get there on their GPS navigation system using this Google My Business listing, they end up at the wrong location. And so now they're upset and they sit there on their phone and they leave you a negative review because they ended up because the address was never updated in Google, or potentially in many other dozens or hundreds of potential other listings, which we call the directory listing ecosystem. So all of that, results in the fact that in today's age, each individual healthcare provider location that is consumer facing really needs to be paying attention to all areas or all of these areas of their web presence, especially if they want to be optimized for search. And if we go back to the pure data that health and medical are the most reliant on Google search, the simple conclusion is that if you, as a healthcare provider, if you don't show up in this 3-pack here, you are going to lose opportunities to get more, to earn more patients. Also, people are seeing your reputation as a healthcare provider or as a practice or as a company front and center when they do these types of searches. And although most searches are done for keyword related, like I'm searching for a pediatrician or a cardiologist, sometimes we get referred directly to a specific physician or a specific practice. And so I may go into search and look for Dr. Michael Yee or Dr. Maria Markarian, because now I want to read, well, what are other people saying about this physician? So that's why your review signals are not only important as a function of showing up in search, but they're also very important as a function of conversion and just a pure reputation. Every physician I've ever talked to, and I've asked the question, what's your reputation worth to you? They actually pause, and they try to actually look and think about, well, geez, in terms of dollars and cents, what's my reputation worth to me? But then typically our mind goes, well, beyond just pure dollars and cents, what's my reputation worth to me in terms of what people, my peers and my colleagues think about me? And these reviews can largely influence that overall reputation of your personal brand and your practice brand. So when it comes to our solution, the first thing that we will do is we'll help a healthcare provider get a handle on, just in pure grading, how is your web presence doing currently? So we'll help them do a snapshot report using our technology to go out there and just do a quick crawl and a quick audit of a healthcare provider's current web presence. And then our algorithm goes to work and scores it based on how other healthcare providers in the space, how are you doing? And then we give them some real data as how many reviews were found, what's the industry average. Okay, in this case, we're doing better. We have 234 for Advent Health, Central Care, Citrus Park, but the industry leaders have actually 497 reviews. So that gives us a benchmark in how this particular healthcare provider location is doing online. We can see how many reviews were found in the last 6 months. We can see what the average review score is. We get insight and feedback on how that location is doing in their social and their directory listings. We can see how they're doing on their website. And so we get lots of data, and we can really get a good snapshot. And these different areas that we're grading and getting data on here, reviews, directory listings, social media, and website, come back directly related to link signals, on-page signals, review signals, citation signals. These signals are really all being graded directly here in this report. Once we have a baseline, and this is really, if any of you are on the clinical side, you understand we do the same thing when we go into an urgent care. We triage them, we get their baseline, we see how's their pulse, how's their blood pressure, what's their pulse oximeter, their oxygen saturation doing. We get that baseline, and now we know what we have to treat and what's healthy, and we can go from there. Once we have this snapshot report, we then put our technology and our staff to work, and we get to work on improving the weaknesses. And maybe it's we need to put some work into the blood pressure, and so we'll get to work on the Google My Business signals if that's an issue. And so we have a technology platform, and we have a human component of our staff that works with the technology to really help manage these different areas of a company or a healthcare provider's location online, in terms of their social media, their directory listings, the customer voices, their reputation. And then we have real-time reporting, which is done weekly and monthly. And then for the healthcare systems, we actually have a brand level reporting, which rolls up data across all of a healthcare provider's locations, whether it's 10 locations, 100 locations, or 1,000 locations. It really doesn't matter. We can associate all of those locations that are boarded into the technology, and we get rolled up data and reporting across all of those locations. So we can see the health of an entire health system across all their consumer facing locations directly within the technology platform. I think my Wi-Fi's or my internet's a little slow with also, here we go, it's loading here, but with the Zoom meeting going and with recording it as well, it's sometimes a little slow. But as you can see here with the multi-location center we have here, we can take, and this is just a demo account of 8 locations that we have rolled up under Advent Health in Florida. But you can see here, even without these demo accounts being really completed and being connected to their Google My Business listing, their Facebook page for each location, and so on and so forth, we're already getting some data and some feedback even around the locations that are connected. And at the executive level, or at the marketing executive level, this is really insightful because you can see how you're doing across a region or across the entire enterprise, and you can literally drill down directly into a location level as well and see which locations really need work and which locations are really strong and doing well in specific areas of their overall web presence. All right, I've said a lot here. Lisa, I'm going to stop. I'm going to see if we have any questions. I don't want everyone to fall asleep after lunch, so let me know what, if there's any feedback, any questions, or if we want to do a little Q&A.
Does anybody have any questions? Is it all too much? They completely understand. They're the first audience we've had.
Amazing, amazing. My practice has paid off.
They told me, Lane, that this area is a little behind the times. Is that fair to say? Yeah. And they told me that Google isn't a big deal here, but Google reviews, but I've told them that it's coming their way.
Well, as you can see here, the reviews are front and center in all searches. So, whether or not people, that goes to human behavior, and certainly, the reviews may not be as important. My guess is because there's not as much competition there, more than that reviews aren't important, but because that's what just even in my, prep for today in doing some searches, there's just not as much competition on the island there as if you were, let's say, in Austin, Texas, or in Los Angeles, or some other big larger CSMA.
I think the other thing too, and you guys correct me if I'm wrong, they've got it's not a huge transient population other than the military families. You've got a lot of your demographic that's just been here forever, right? I mean, is that?
Sure.
Yes, fair. Some people are looking at me now that it might not be, but. Okay. Yeah, so for their specific area, it's maybe a little bit older demographic, and they've been here for a long time.
Mm-hmm.
I think they have a lot more reviews on Facebook, correct, than they do on Google, but I want them to be thinking Google reviews and getting ready for that.
Well, I mean, even if it's not as important or as influential on the island as it is in the mainland, this data is still relevant and true. And so focusing on Google, Lisa, you're right on in that Google's still going to be the largest driver of traffic even on the island, right? So making sure that you do have reviews and you have your best foot forward on your Google My Business listings should definitely be part of your strategic initiatives in 2020 and beyond. The data is there, and although maybe the island is a few years behind. Like Lisa said, it's definitely coming, and it certainly will pay off. I know from a reputation standpoint, every physician has put hundreds of thousands of dollars and many, many years into, their craft, who they are as a physician and their expertise, and want to always put their best foot forward. And focusing on Google will definitely pay off because it is a big driver of traffic.
Lane, can you speak to a little bit? I was trying to tell them, and using my coffee bar sort of as an example, the majority of my reviews are good, 5-star, but I also have, those disgruntled people that get on immediately and leave a bad review here or there, but just the amount of work it takes to get if you aren't consistently looking and seeking and getting reviews, the difficulty it can be to get your star rating up where it needs to be. Because you've always told me it needs to be at least 4.5 or more, right?
Well, ideally 4.0 or higher. It's statistically, there's a noticeable drop in conversion rate under a 4-star rating. And I think all of us would probably agree that when we're looking for any kind of provider or service or product, that we just naturally gravitate towards those higher 4-star ratings, as close to 5 as we can get. And anybody who's in the 3s or under, especially if we have options in the 4 stars, we're just going to naturally, even our eyeballs are trained to go towards the better ratings. So definitely being over 4 stars is the first milestone, and as high or as close to 5 stars as one can get, for sure. And Lisa, to your point, yes, getting ahead of the curve is really important. And here's why. And here's an example. We have Dr. Michael Yee here. Okay. He has no reviews, no bad reviews, no good reviews. Okay. No problem, right? Yeah. The only thing is that if Dr. Michael Yee gets 1-star review, it's going to take a lot more 5-star reviews to combat that 1-star review and to get him as an average back up to over 4, right? And so if you can seed, statistically, if you can seed your Google My Business listing with around 10 4 or hopefully 5-star reviews, you're going to effectively neutralize the potential for a 1 or a 2-star review that may come in, and probably will come in at some point. It's just part of, the more successful you are, the more people you touch. The more people you touch, the more chances there are that you're going to find somebody that you just cannot satisfy, no matter how much you roll out the red carpet, and you're going to get that 1-star review. Dr. Yee would be so much better served if he would just get even family, friends, some of his best patients to go leave 7, 8, 10 5-star reviews for him, and effectively neutralize any potential 1 or 2-star review that may come down in the future.
Can you talk a little bit about naming conventions in the Google signals?
Yeah, I was just going to bring that up. Relative to the rebrand that Adventist, and Castle is going through, right? This is really important, and it relates specifically also to the NAP consistency, or the name and the address and the phone number. In this case, we're talking about the name. Okay, so Googlebot is crawling the web, and every entity has a name. And so when there's a name change, it can certainly confuse Googlebot until we train Googlebot that, hey, this is the new name of an old name. And we really have to try and create associations very purposefully to really retrain the algorithm that this is the same location, it's just got a new name, right? And so, you also want to have consistency, as you can see here, in your name. And so one of the biggest issues I see, and it's really simple things, but is just, you can see like Sarah Canyon, MD, PhD, family medicine physician. Now, I could go out here and do a search for Sarah Canyon, MD, and we could see, how consistent is that really her business name? Because in Google, she's listed as Sarah Canyon, MD, right? As you can see here, PhD, family medicine physician. But you can see here, she's just listed on the Adventist Health website as Sarah J. Canyon, MD. Here, it's not Sarah J. Canyon, it's Sarah Canyon, MD. And then we can see here on health.us news, she's Dr. Sarah Canyon, family medicine doctor. Well, as compared to her Google My Business listing, she's a family medicine physician. I think I've already probably made my point. You see the dramatic differences and inconsistencies in just the business name for one physician at Adventist Health, right? And we're not picking on Dr. Sarah Canyon, especially if she's in the room. Yeah, right. It just, by chance here, but this is the point that Lisa's bringing up, is how often inconsistent it is. And what we're doing is we are literally confusing Googlebot, because Google's trying to see, well, is this one location, one physician? Is this a practice? Is this multiple people? Are they different? And so although Google's smart and can figure a lot of this out, because obviously we searched Sarah Canyon MD and we're getting a lot of the very relevant results to Dr. Sarah Canyon. So Googlebot's still
She has
smart.
good reviews.
And she's got 4 or 5-star reviews, yeah, which is great. And even a good 1 5-star review on Health Grades. But you can see there, if we would do so much better, if we would make it easy on training Googlebot and just use the same exact business name all the time and not vary it from one, and so you can take this to a healthcare system level. And when you have hundreds to thousands of locations and some to all of them have inconsistencies in the location name, you can see how this problem can really mushroom quite substantially.
Well, it's like Taco Bell, Starbucks, they use the same name everywhere.
You got it.
Anything else important we should know, Lane?
What about like recruiting reviewers? Any methods?
Hold on, I'm gonna let, Chad is our marketing, representative, and, I'm gonna let him ask you, I'm like, talk show host. There you
Hello. Okay. Do you have any tips for recruiting reviewers to Google?
Sure. Money?
go.
No, just joking. First of all, the response, asking for the review very quickly on or after the time of service, right? So if I'm a patient and I've just come in to see my physician or my healthcare provider, and on the way out, I go past the front office and the front office administrator or the director of first impressions thanks me for my visit. Really great to see you today, Mr. Hauk. Oh, by the way, would you be okay with us asking for some feedback from you? And if we sent you just some feedback to your email or to your cell phone via text message? No, I'd be happy to share some feedback. Great, you'll get a text message or an email from us. We know, depending on what you choose to do with in terms of asking for that review. But if you just spend literally 20 seconds with something like that on my way out, and then very quickly thereafter, I get that email or I get that text message. And by the way, our software helps with that. In other words, we have a component in here where you can go into the reputation side of the software and very simply put a name, email address, and or phone number and send out that feedback request. Then the likelihood of me responding, because I was just prompted a few minutes ago on my way out, my chances of responding, and we've seen this in terms of just real data, go way up. And especially if I get the request via text message, because as you guys know, we typically see a 10 to 20% response rate on email. We typically see an 80 to 90% response rate on text messages we get on our cell phone. So I guess to sum up that tip, if you have somebody trained in terms of the service experience to prompt somebody, the patient as they leave, that we would like your feedback, would you mind if we sent you a request and make it easy on you? If I give you my permission, I've now really mentally, I'm already expecting that request. And when I receive it, especially if I get it via text message and it's convenient for me, you're going to see your response rate definitely go up with the usage of text messaging and the prompting as I leave the practice or the provider's location.
Any other questions? Comments? One more.
I was just wondering if, is there a position for this that people on the mainland are doing in healthcare that is kind of like in charge of this particular area of Google? I mean,
Well, I can answer that question. We've had a hard time finding who's in charge. So
Yeah.
it's really hit a lot of the healthcare, the big systems. finding out who's in charge of it. Many of them are scrambling, trying to figure out how the process works and who should be responsible and where it is. We have found, Lane, it's under marketing somewhere.
Digital marketing.
Yeah, in some cases, they've got a combination of their IT department and their marketing, but it's definitely not a function of IT. Just because they have computers under their purview doesn't mean they.
And it's not even a function of digital marketing either, right?
No, right. Go ahead, Lane.
I can kind of share with you what we found at Advent Health in Florida was that they had somebody in digital marketing that was directly in charge of like the reputation and the reputation management and being notified of all new reviews, responding to reviews. And obviously because of the reviews and reputation is directly linked to each location. That was a part of it, but what we have found and what we found even at Advent Health with, a little over 1,000 locations is that there's really no one directly in charge of Google My Business signals and really managing that listing on an ongoing basis. And then the location data component of that as well in terms of making, each location's data consistent? Is it correct? Is it being managed? When there's when a location moves, from one location to another because of a new building or what have you, there's a lot of times where there's a huge lag time between when that location data is updated live in real time into Google and other places. And so we've seen a big gap in this area, and the more locations a healthcare system or provider has, the bigger that gap is. And the biggest reasons why is they just don't have the human staff in the marketing departments to truly manage all these different components of a web presence. And then they don't have the technology in place to work alongside them as the human staff to really help them manage it. And so there is a big gap. It's a great question.
I have one more question.
Oh, one question, hold on.
Thanks for doing this. I have
My pleasure.
We've heard some, things about what you're supposed to do with this. I'm curious about other than inactivity, what are the big mistakes people make in trying to get people to go to their Google My Business and leave good reviews?
Lisa, could you repeat I lost part of that question. I'm sorry.
Sorry. So what are the mistakes people make in doing this other than inactivity? What turns people off?
He's specifically, thinking about, I believe we had a discussion. We have an employee in the room that had some service done on his leg, and I asked him if he had left a good Google review, and he said no, because he was an employee. He didn't think he should do that.
I want to know who that is.
We won't name any names. So, are there some pitfalls, or are there some bad things that could happen, Lane, or anything that you've seen by people actively asking for reviews? Obviously, if you have a patient that's leaving disgruntled, you're not going to say, oh, go visit our Google site and leave a review.
Right.
But can you speak to that?
Well, I think it's a good question for sure, because you have to be sensitive with it. I think it's just being too intrusive, or asking too many times. The repetition of, I typically say, ask 2 or 3 times and then let it be, until they come back again.
Lane, I love you.
We said we'd quit bullying him, so.
Yeah.
It hasn't stopped.
This is the last class, so I'm done.
I might leave a review, but it's
I think everyone's ready for happy hour is what it sounds like.
Probably. All right, any other questions? I don't think that really answered your question, Will, but I mean, obviously you don't want to, the same patient, if you have coming.
I get the sense of just be active and do it.
Yeah, be active and do it, yeah.
Exactly. You know, here's the thing I can tell you for sure. If you do nothing, you're going to you will by default develop a negative reputation. And here's why: it's just human behavior. You and I, if we have a good, even a great experience, we'll appreciate it. We might even be thankful and go back and go, that was a pretty good experience. And then we probably will move on with our day. We're busy and we're moving along. However, if I as a provider really make sure that Will has a really, really bad experience, through either just negligence or because, the people that are providing the service that are crabby and not helpful, and Will's really, really ticked off, he's likely to go jump through a couple hoops, maybe many hoops, to leave the word of that experience online. And although you or I may not be those type of people, there is plenty of vengeful people who are just looking for an excuse to go leave a negative review because they're just those types of people. And so if you leave it to default, by nature, you're going to attract a negative reputation because people will jump through many hoops to go talk about their bad experience. Although even if you incentivize people to tell the world about their positive experience, you still can have a difficult time. So it's better to get ahead of this and be proactive about it than it is to just kind of put your hands up and go, well, we'll wait till there's a crisis of a 1-star, reputation, and then we'll pay attention to it, which is what you don't want. You don't want to have to be in crisis mode. And everyone is one negative review away from being in a short or even a potentially longer term reputation crisis.
All right, thank you, Lane. We have another class visitor, so I've got to get him up and going here. But thank you, I appreciate that. Is everybody?
Thank you.
My pleasure.
Thanks, Lane.
You bet. Have a good one, everyone. Take care.
Yep.
Bye-bye.